Hi everybody. I'm just waiting for people as they join. We've got a few people in the waiting room coming in. So last night, if you were here, there's a few names that I recognize. Unfortunately, the recording didn't work in the end. So I did cliff notes on Instagram's my IGTV today instead. So you can go and watch the cliff notes over there. And I'll be sending the what do we call it, the PDF, just after this to the people who requested it. Yeah. Let's watch this waiting room. Okay, so if we haven't met before, you're not familiar with me, my name's Natasha. I'm the founder of Forage Botanicals. I'm a medical herbalist, and I have over 10 years experience working with people with period problems of all sorts, really. But endometriosis was quite common for me to help people with. And that's going to be the mainstay of today. It was queried at one point that I might have endometriosis myself before I had my son, because the pain that I experienced was severe, but not as long-winded as a lot of people with endometriosis will be. Just out of interest, if you could click on the chat button at the bottom of the page and tell me if you have been diagnosed with endometriosis, or if you're just here because you're curious and think that maybe it's something you have. I imagine that those are the two reasons for being here. I suppose you could be just wanting to learn about herbs and endometriosis. Yeah, Yasmin, cool. Some people have been diagnosed and others just interested. Okay, cool. Ah, you are training. Oh, wonderful. Diagnosed 8 years ago. Okay, cool. Oh, all right. That's good to know. So I'm just going to share my screen with you. Oh, right, that's interesting. What's interesting, there's a couple of practitioners or practitioners in training in the room. Oh, I've got the wrong document up. Hang on, it's from last night. There you go. Okay, so I'm gonna kind of go through the content with you, and feel free to butt in with questions, but if I miss them, I'll come back to them at the end. So don't worry if I don't see them to begin with. Sometimes when I get in the flow talking, I miss questions. I'll try to keep an eye. Okay. For those who are practitioners, could you write down like what therapy you work with? That'd be great. I'm just being nosy at this point, really. So that's me. All right, so what's endometriosis and adenomyosis? So these are both illnesses where endometrial-like tissue grow in places that aren't the endometrial, where the endometrius would normally be. Endometrium would normally be. Whew, read these words far too much today. So they ebb and flow just like the endometrium does, which means that when you are going through the second half of your cycle, where the endometrial growth is at its most, then these tissues are also growing. And also when you have your normal period, they are also want to release somewhere but don't know where. And that means that you can end up with chocolate cysts. This is like where the body contains the blood within its own sort of tissues. And then these cysts can sometimes rupture, but that's very much dependent on the individual. A lot of the time that doesn't happen, but it depends where it's growing. So usually endometriosis is growing on the ovaries, the fallopian tubes. Sometimes it can grow on the bladder and the bowel, and what else? Uterus, uterine, ovarian ligaments as well. Probably the one I didn't mention. So it means that you can get adhesions that will link the bladder and the uterus together, or the bowel and the uterus together, and it can create symptoms that seem like IBS or cystitis. And it's a bit of a red herring. I mean, it is helpful to treat them symptomatically as though they are irritations of the bowel and the bladder, but actually the underlying cause is the endometriosis. So adenomyosis is the same growth, but they happen within the uterine walls of the muscles of the uterus. So it's just a different pattern of growth. I don't know why, but people seem to really like feel divided if they have like endometriosis and adenomyosis sometimes, but it's really common for people to have both. And it's often like thought of as a reproductive health issue, right? Because it happens within the uterus, and if you're not a woman, then you can't have it, or at least if you don't have a uterus, you can't have it. But it's a sort of a red herring. It happens a lot with women's health problems, that just because it only happens if you have a uterus, that it must be being caused by a uterus. But that isn't the case. It's we don't really understand exactly why it happens, but really it's better to think of endometriosis as an inflammatory process that is heavily linked in with your immune system. It's often a bit of a fool's errand to think of it as primarily due to estrogen dominance, though that is characteristic of the condition. Come on, there we go. And you can have estrogen produced in lots of other parts of your body other than your ovaries. So just because if you had a male body, that doesn't mean that you don't have estrogen, just like FYI. Your liver, your intestines, and your fat cells all produce estrogens. So what can we do herbally to help with endometriosis? I think I would like to cover like how you get it diagnosed as well before we move on, and the kind of treatments that people are normally offered as well. So if you think that you have endometriosis, it's likely that you're experiencing severe pain. That's the main characteristic of it. It may not affect your menstrual flow or your regularity, but often it does. And you might find that it's associated also with anxiety or depression because the pain is so overwhelming. And you can experience pain not just when you're menstruating, but at other times during the cycle too. So yeah, it's not uncommon for you to have pain for more than one day a month. Like it can be, I've had friends with endometriosis where the pain is almost always there, like at least 2 weeks of the month, but sometimes almost always there, to one extent or another. And it depends on like the severity of the adhesions and growths and things. And the only surefire way of being diagnosed is to have a laparoscopy, because this is where a camera is inserted through the, I'll go like this, where a camera is inserted through the abdominal wall and into the uterus, and it will have a little look around and they'll take a sample of the tissue and have it tested. And then it's the only way that they know for sure that it's endometriosis. It doesn't show up on a hormone test necessarily, though estrogen dominance is typical of it. It's not always there. And you can have estrogen dominance for other reasons. So it's important to have a laparoscopy in order to make sure. It's like it's invasive, but it's keyhole surgery. So it has a short healing time, but that you shouldn't take it for granted. Keyhole surgery is still quite, you still need to allow yourself to heal. And I think sometimes if you can't see what's happened, then you don't give yourself long enough. But yeah, so it's important to do that. But if you should be aware that having a laparoscopy can leave scar tissue where the incisions were made. And so if you're like me, where my pain was severe but short-lived. It was only 1 day a month where it was incapacitating. Although we queried endometriosis, I didn't feel that it was worth my personal while to have a laparoscopy and potentially jeopardize my fertility a small percentage for the benefit of discovering if it was or not, because I knew that I could treat it holistically without having to have that. And if it improved, then that was great. If I discovered later on after trying to have a baby that I was struggling, then I would have been more inclined to. So you have to weigh it up and see what's right for you. On average, it takes like 8 years or 7 years in the UK for somebody to be diagnosed with endometriosis. And so that's an average. That means that sometimes it takes a lot less and sometimes it takes a lot more. I think the maximum I've read is like 14 years. And if you're suffering in pain for that amount of time, that's a long time. Usually you are offered surgery to deal with endometriosis. The general idea is that if they remove the endometrial-like tissue, then that is cured. And that does seem to improve people's pain levels for an amount of time, but it's not a cure. Even the removal of the uterus itself will not cure you. A hysterectomy is not a cure. Endometrial-like tissue can still grow back. And sometimes I think that is not made clear enough when hysterectomies and surgery are offered as options as treatment. So it's very important to know that. So what we can do herbally is a variety of things. And this is essentially like what makes up my prescriptions when I see a patient who has endometriosis. So it's important to reduce inflammation. And I usually do this with pain-killing herbs like white willow bark. It's an excellent herb to work with because it is pain-killing as well as being anti-inflammatory. Or meadowsweet is another lovely anti-inflammatory. These both contain salicylic acid, which is the chemical component that creates aspirin as well, another painkiller. It's important to support the liver because if there is estrogen dominance, then if by supporting the liver to process that estrogen faster, you are hopefully reducing the estrogen in the body, but in an indirect way. So if there isn't a problem with estrogen, you haven't created an issue. I like dandelion root, especially. This upregulates the processing of the liver by increasing it tastes bitter, so it increases bile in the system. Whereas milk thistle is especially good if you have some sort of reason to think that your liver may have taken a bit of a beating over the years. Maybe you've had to have lots of drugs or medications, or you've had to, or you've drunk a lot. Hopefully you didn't have to drink a lot. Milk thistle is excellent for increasing the rate at which the liver recovers from damage. So they work a bit differently. I would argue that if you're having to take medication, then you should avoid things that increase the rate at which your liver deals with toxins, because it will reduce the amount of time the drug is active in your body. This is me, like, it makes sense. But I don't think anyone really pays attention to this. Whereas milk thistle will be perfectly safe because it is improving the rate at which your liver recovers from something. It doesn't increase the rate at which something is processed. I hope that made sense. You should also heal and cleanse the uterus. For this, we want uterine tonics. So I've recommended Lady's Mantle and Raspberry Leaf. These are readily available at places like Neal's Yard Remedies and Baldwin's. Uterine tonics are lovely because they help improve the health of the uterus in a non-specific way. They just work as an overall tonic. Nobody really knows exactly what they're doing, but clearly they help the uterus. They help with things like heavy flow, especially, but also I found it helpful for me. I found it helpful for pain. I've had other people say that it helped with their fertility. Raspberry is especially related to giving birth and the recovery after birth. So they really have wonderful properties all the way through a woman's reproductive years. Then I would recommend relaxants. Having a good balance with your stress hormones and relaxation is really important for your overall health. And having a dysfunctional stress response means that your immune system is also dysregulated. So working with relaxants is important. Skullcap is a nice one if you feel really in your head all the time and are struggling with overthinking. Passion flower is really nice if you want to get more of a sort of dreamlike state. It's lovely just before bed. On this line of stress, reducing cortisol is important. For this, you are going to be helped by the relaxants, but also a group of herbs called adaptogens. I love ashwagandha because it is so relaxing, whereas Siberian ginseng feels like it gives you energy. And for people who are experiencing chronic pain, their energy can feel really zapped. And so working with something like Siberian ginseng can give you a real rush of energy. Equally, on that note, if you actually are suffering with sort of a chronic fatigue because of the pain that you've been experiencing, then it might be too stimulating and ashwagandha would be better suited. Decreasing estrogen is often something that people think is like obviously really important because it's something that's characteristic in endometriosis, but it can be a bit like putting a bucket under a leaking roof. It's not necessarily the cause of the problem. It's more likely to be a symptom of the problem. So I usually recommend that people leave dabbling with estrogen to the herbalist and work with the protocol that I've already mentioned there. But if you're training to be a herbalist, then you'll learn the herbs that reduce estrogen, like phytoestrogens. Phytoestrogens are quite nice because they sort of balance estrogen anyway. They are less potent than the estrogen our bodies create. So they will sit quite nicely in an estrogen receptor if there's no estrogen there. So they'll give you a little bit of a boost if you don't have enough estrogen in the body already. But if there is too much estrogen, or rather you're oversensitive to the estrogen you have in your body, then they will take up position in a receptor and make you feel like you have less. So actually they're kind of balancing, but still, nevertheless, I still recommend that people work with a herbalist when it comes to that. So I recommend that you get these kind of herbs from Neal's Yard Remedies in Baldwin's. You can order online from them. The easiest way to take a herb is tincture, probably. It's an alcohol-based preparation that you take in drops, like a dropper like this. You would probably take 5 mils 3 times a day as a medicinal dose of a tincture. And you might want to pick one herb from each of these slides, combine them in equal amounts, and take 5 mils 3 times a day. And that really is quite a complex prescription that you would be taking then. Literally can't see further than this. I've had my glasses off, but the glare is a bit of a cat problem, I think. And then infusion is simply a tea. It's a very nice way to work with herbs because it gives you the ability to really taste them. It helps you just slow down and relax because you're taking the time to prepare it. And it's best suited to flowers, leaves, the more delicate parts of the plant. Whereas a decoction would be used if you're working with the roots. And ashwagandha and Siberian ginseng are both roots. So they are better if you decoct them. And this means that we put them on cold water in a pan on hob, bring it up to a boil, let it simmer for about 10 minutes before straining it and drinking it. And with both of those preparations, you are going to drink them 3 times a day for a medicinal dose. So quite high amounts. And then powders, if you get a hold of powdered herbs, you can make them into sort of lattes by just adding them to nut milks. So this is what I make here, Rested Resilience. That's my herbal latte. I want to make more. This is ashwagandha powder, hawthorn, oat, and some chai spices. This is especially good for lethargy, for long-term stress, and exhaustion. Some people say it really makes them feel like they've had a coffee, and other people say it's really relaxing. So it has that really nice like balancing effect depending on where you're at. Then we have the premenstrual piece. These drops will help with day-to-day reduction of stress. If you do have heavy flow with endometriosis, then the art flow drinking chocolate will be helpful because it has nettle and raspberry in along with the cacao, which makes it rich in iron. Hidden there is drops of Inner Goddess. I really like these for uterine. It's full of uterine tonics. So long as you're not trying to conceive, it's perfectly suitable. But it is working at more of a emotional level for you to connect back in with your uterus than a physical one. You only take drops of it, whereas like a physical dose from a herbalist is usually 5 mils 3 times a day. So last but not least, I wanted to draw your attention to a course that I'm starting in January. It's not so much of a course as a mentorship, really. I'm taking on 10 women starting in January, where I will be giving individualized advice to people, but in a group community setting. So we'll be doing all of the sessions that I would normally do with a patient, but as a group. So it's going to be lovely and supportive. And rather than me telling you what herbs you should go and take, it's going to be much more communication based, where you're going to be choosing those herbs and I'm going to be helping you with figuring out what's going to suit best. So this is really something about empowering people, and I'm going to be working with this group for 6 months, so it'll only be open twice a year. So yeah, the first one starts in January and the next one will be like July, right? So I hope some of you may be interested in that, but I would love to take your questions if you have any. Hi Yasmin, will I be doing any summer workshops? I'm not sure at this point because this summer I will be getting ready for handing in my dissertation for my master's, and I'm not sure if I'm going to have the brain space to run any workshops this summer. But once it's handed in September, so autumn might be a really active time for me because I might just be like so done with writing university work and really want to do some more stuff before it. Massage and herbal medicine, massage reflex. Ooh, lovely. I feel sorry for all the masseuses right now because I know it's so hard this year for you guys. Yes, Annalisa, I know you're on the Botanica course. I'm so happy for you. I'm really happy that you're doing that. It's lovely. What can help with fertility and endometriosis? Well, you need to try and reduce the endometrial growths in order to aid fertility. Okay. So I think that usually the underlying thing with endometriosis is to upregulate the immune system. And usually when I do that, when I'm working with patients, then I work with immune modulators. I don't do this lightly. So usually like endometriosis is something that I don't talk about herbs very much because each patient is so individual. And the reason why fertility is an issue in endometriosis varies because it depends where the growths are. It could be interacting with your ovaries and therefore your ovulation. They could be interacting with the ability for an egg to pass through the fallopian tube, and they could be interacting with the ability for an egg to embed in the endometrial wall. Things affecting fertility that you'd want to know about is like how thick is your endometrial lining able to get? Is there blockages to the fallopian tubes? And is there any reason why you aren't potentially ovulating on one side? And you can find out some of those things by observing things like, how long do you bleed for? Are you getting a healthy red blood when you do have a period? Or is there a lot of sticky blackish brown happening, in which case maybe the circulation is implicated? We need to work with that. Is there If there are blockages to the fallopian tube, that is very tricky. You would probably need to have a laparoscopy to figure out where the endometrial growths are, and then decide if surgery would actually be best. But you do have to bear in mind that every time that you make incisions in the body, you're creating scar tissues wherever you go. So it's like weighing that up. If you have time on your side, then it might be worth working with a practitioner for, say, 6 months, maybe even a year, where you try and reduce the endometriosis symptoms significantly and thereby improve your chances of conceiving. Definitely work with anti-inflammatory things. These help with conception, generally speaking. Definitely work with ashwagandha for a minimum of 3 months, because ashwagandha improves, not only does it help us with stress, but it improves fertility directly. It actually improves the quality of eggs. And the egg that you conceived with started its life actually 3 months ago. So you need to work with ashwagandha for a minimum of 3 months before conceiving if you want the egg to have been affected by it. And if men take it, it improves their sperm quality too. So it's a good one. Everyone should be having ashwagandha if they're thinking about conceiving. So yeah, there are physical things about endometriosis where surgery is probably implicated. But if you can work with the immune system to essentially, like, part of the problem with endometriosis is that your body has said, oh, it's okay for endometrial type cells to grow there, which is not. And it's like, why did the body allow that to happen in the first place? Your immune system should have been like, whoa, you're not supposed to be here, mop you up. And so usually stress is implicated in that immune dysregulation. Such a rant, sorry. Hopefully it was informative, not just ranty. Oh, you're about to freeze your eggs. Yeah, I think it would be. I actually had once, I've worked a lot with people who are going through different types of IVF. I actually had a patient once who had struggled with her egg quality and quantity when they did their first extraction harvest of eggs. And then we gave her ashwagandha for 3 months, and they actually said there were so many eggs to choose from. There was like too many eggs for them to choose from that were high quality. So yeah, I would really recommend it. That is obviously just like one case, but there were also studies on improving egg quality. Not necessarily quantity, but quality, but it did both for this woman for whatever reason. I hope you don't mind me reading this out, because people won't understand the answer if I say this. So someone's asked me, I've had endometriosis-like stuff severely at 2 points in life, and both times stress levels were really high. Yeah. It's good that you were able to make that connection, because it means that you can work with stress in the future. So obviously, like, learning, sometimes we can't control our life, right? It just is stressful, like COVID. And I think that it's good for us to be able to acknowledge that things are stressful, so that we can take herbs like adaptogens on a daily basis throughout these times to prevent us from getting to the further stages of stress. There's a long, slippery scale from health to illness, right? And there's a lot of gray area in between, where you might have symptoms, but you're not yet sick. And a lot of my educational programs work with that phase where you haven't been diagnosed with something, but you're not feeling well, and improving that. In this case, today we're talking about endometriosis, where you've been diagnosed with an illness, right? But adaptogens can help us to come back whatever the stage we're at. So I think it's important that we work with them regularly. And then I have a fun little like online test you guys can do, which will tell you what stage of stress you're at. Because there is a point in stress where we adapt to it and it feels like nothing is happening anymore when it is. And yeah, just being able to recognize that your stress is often the first hurdle. So the fact that you've been able to connect the two things is a remarkable breakthrough, and you shouldn't take it for granted. That's okay, Helen. It took me ages to figure out how to like get it off private messaging. So people are sending me private messages by accident, I think. So here's another. I have been having increased ovulation pains and have been diagnosed with endometriosis. Is there anything specific you recommend for this, or the herbs you mentioned generally? So so the anti-inflammatory ones specifically will help with that pain you're experiencing. So what happens with endometriosis is that although the body has allowed the endometrial tissue to grow places where it shouldn't, I should say endometrial-like tissue to grow where it shouldn't, it still creates an inflammatory response once it's there. And so that's what leads to the experience of pain. So taking anti-inflammatories like white willow bark and meadowsweet are your first line of defense, but also try to avoid foods that are inflammatory. Sugar is inflammatory. Wheat can be inflammatory. Well, wheat is definitely inflammatory. Dairy can be an issue for some people too. I have a friend who has endometriosis, and she finds wheat and dairy to be an issue for her inflammatory response. You can also supplement with anti-inflammatory supplements like evening primrose oil or fish oils, depending on what you respond to, and you won't know unless you've taken it for a month whether it was the right thing. I found personally that I didn't respond to fish oils, but I responded to evening primrose oil. It's a really technical thing, like you need to just try both. Or try one and then the other. That's what I mean. Prior to seeing a herbalist, what else should I do test-wise to prepare for therapy? I have endo diagnosed post-miscarriage, yeah, post-surgery to remove fallopian tube. What therapy do you mean there, Camilla? Do you mean surgery? I think you mean surgery to remove the fallopian tube. Yes. Okay. To prepare for having it removed. Oh, therapy to conceive. I see. I'm trying to think like what would be specific. So you're saying that you have endometriosis, that it affects your fallopian tube, and you're having therapy to help you conceive, right? And you're asking me what tests to prepare for conception. Sorry, I'm finding this really hard to understand. It's because I didn't understand where your brackets have gone. I'll give it a go. So, or do you need to do anything prior to seeing a herbalist? No, don't need to do anything prior to seeing a herbalist. So you can speak to one of our herbalists for free for 30 minutes just to get an idea of like what our treatment plans are like, and they will explain to you what we do in a treatment plan. The bare minimum time that we work for people is 3 months. With endometriosis, especially with it being often a very long lasting illness, usually 6 months actually is more realistic to see significant changes. But within 3 months, we should be seeing improvements for fertility. So you don't need to do any tests or anything, but we might recommend investigations. So we might recommend that you go and, for instance, have your fallopian tubes checked if you can. We might, more than likely, if we were going to do anything, we'd have your hormone levels checked to begin with to see if that's interacting with things. This is something that we can do for you. We'll send you off for phlebotomy, aka have your bloods taken, and then have them checked privately. But you might be able to press your GP to do some of the tests for you. But it's worth bearing in mind that in the UK, annoyingly, you have to wait 6 months of not conceiving before they're willing to do anything to help you. So that's annoying because you can do a lot in 6 months with herbal therapy. So yeah, we could send you off for bloods, but most of the time we just listen. We listen to your symptoms. We look really intensely at what your menstrual cycle experience is like. We look at like how much blood are you getting, what your cervical mucus is like. We can ask you, oh, this is one thing that could be quite good. If you start taking your basal body temperature in the morning and come with that, come with your basal body temperature for the last month, that will really help us because it will help us to understand if you're ovulating and when. And often that fertility awareness method is something that we teach patients to do so that we have more information to go off. Because if we understand what's happening with your cervical mucus, your cervix position, and your basal body temperature, then we know when you're ovulating. If you're not ovulating, we can tell more about your level of fertility. And if you have fertile cervical mucus for a long time frame, then we know that you'll be able to keep sperm alive for longer, which means that you don't necessarily have to have sex as frequently in order to conceive. Yeah, there's lots that we can tell without you actually having to go and pay for more tests. Ooh. But yeah, I would recommend that you can either contact me directly through my email address, or you can leave me your email address and I'll send you an introduction with one of our herbalists. And if you find that the treatment plans are too costly for you right now, then maybe this 6-month thing that I'm starting in January would be better. I'm hoping to have a few people with endometriosis on it. I'm expecting to have people with PCOS on it, and I'm expecting people to be at least curious about how these things are affecting their fertility, if not actively trying to conceive. Hi, Helen. You have endometriosis. Oh, sorry. Can I just check that answered your question, Camilla, before I move on? Okay, good. Great. And then Helen's asking, you had endometriosis diagnosed 2012 by laparoscopy and it was blasted with ablation. Okay, that means that was basically like burnt away. And then last 3 years since having had a miscarriage, your periods have been much better, but recently more pain has started to recur between periods, along with other symptoms like the bladder and bowel. GP says it's probably adhesions from the laparoscopy, possibly endometriosis too, but to avoid further invasive stuff, would your approach be anti-inflammatory stuff? Yes, so I think that your GP's done a really good diagnostic there. I think that they're right. It's probably very likely that that is what's happening. And to have another laparoscopy would only add to it potentially. So, but I think that you've got a good GP there. So that's nice. I would, of course, recommend working with a herbalist. I do feel that that is very important with endometriosis, that people, if you can, work with a herbalist one-to-one, then do. If you can't, then work with me in the group coaching setting. The kind of things that are going to be helpful for you are going to be anti-inflammatory things, like we've mentioned. Basically, the herbs that I've mentioned today, but also what I would be able to do if we were working together in the group is offer up suggestions for phytoestrogens and estrogen balancing herbs, and to understand. So what I can do if we're in the group setting is I can tell you how you should balance your prescription. Should you have more immune stuff? Should you have more anti-inflammatory stuff? Should you have more phytoestrogenic things? And to understand like how to balance those levels is very individualized. So it's hard for me to say. I've given you all that I can in a general sense today. But there is also on our website an endometriosis section with an endometriosis ebook in it, which is actually the endometriosis chapter from this. So inside my book, which is like this thick, contains an endometriosis chapter, and you can buy that as a standalone, as an ebook on my website. If you go to my website, I'm going to just show you how to navigate my website, because I feel like I still haven't quite got it simplified enough for people to actually navigate. I try. Every year I look at it and I think, is this really the best way to lay it out? Okay, let's show you. This is how my website works. So up here, period problem resources. And then here, endometriosis adenomyosis. And then there is your ebook, £4.50, nothing. This includes tips like dietary changes, as well as the herbs I've mentioned today. Then we have like blogs that may or may not be relevant, depends on your situation. I specifically made a herbal painkillers for endometriosis guide once, with little mini monographs in about the plants. So that's kind of cool. I forget that that's there. I'll have to check if this is all still working. Yeah, so you get the herb guide. I'll have to check that that's still working. If you try and do anything on my website and it doesn't work, please just email me and tell me, and I will sort it out. It's just like, it's been going for so long now that I forget what's there. Then I've kind of highlighted some supportive products for the pain levels. I didn't even mention this. For the pain levels, I recommend my Moontime Belly Balm. I've had people use it who have endometriosis and say that it helped, not necessarily completely cured all their pain symptoms, but helped. And the premenstrual me time bath salts also can be really helpful because they're rich in Epsom. So yeah, I forgot to even mention them. And then I need to change this last bit because I've literally just launched today the 6-month, what I'm calling it, menstrual wellbeing collective, which is open to just 10 people. Oh, Helen, I know, I can't treat myself. It's too complicated. I always go and see another herbalist. You just can't see yourself clearly enough. Very hard to be objective with yourself. So this it doesn't make you a bad herbalist at all, just makes you a human. So if there's no more questions, then I'll leave you there, but I'll just double check. Tomorrow we're looking at PCOS, and the next day is heavy periods and then light periods on Friday. Okay, cool. Well, thank you for joining me tonight. It sounds like I'm going to be seeing some of you again tomorrow, so that's nice. And it looks like this recording actually worked throughout, so that's good. And I'll send Yasmin, I'll send you the notes from yesterday. And I think that's everything. 6 o'clock tomorrow. See you guys there. Bye. That's no problem.